Tonight, on My Sense, I reflect on the state of the Social Health Authority and the Social Health Insurance Fund. For ease of reference, the state of SHA and SHIF. Last week, the Ministry of Health updated the country of the challenges that SHA and SHIF are facing just over 4 months since the rollout. They told the nation that 19.3 million Kenyans have so far registered with SHA, but with a regret that only 3.3 million people had been processed through the means testing instrument and therefore actively contributing to SHIF. They also said that at least 1 million Kenyans had accessed primary healthcare services since October 2024. Let's make sense of those numbers. Last October, the President and top officials at the Ministry of Health told the country that the Social Health Authority had transferred up to 9 million NHIF members to the SHA platform. They immediately began telling of how successful the registration drive was becoming, with figures moving from 12 million to 13, then 15, and now 19.3 million registrants. They also told that there was a means testing instrument that once a person was registered, it would determine how much they should pay per month and per year. We were told it was working. And then something happened. It had errors, and the instrument needed review to make it more accurate and more efficient. It's been 4 months, and now we are told that 3.3 million people have been processed through the means testing instrument. How did that happen with an inaccurate instrument? When Health Director General Dr. Patrick Amoth spoke at the press conference last week, he said, and I quote, "We cannot only have those in informal employment bearing the burden of the rest of the Kenyan population." Now, the figure of 3.3 million tallies with data from the Kenya National Bureau of Statistics that puts the number of those formally employed at 3.3 million. Why not just say that the only contributors are those in formal employment? But wait, what happened to the 9 million that were moved from the NHIF database to SHA? Most were already contributing, right? Wasn't there a better way of handling the transition? And so what has the hype of a registration been about if no much effort is being made to ensure payment? And when the ministry says 1 million have accessed primary healthcare services, who are these people? Are they ever guided on how to contribute to SHIF? One more thing. You remember the outcry about the SHIF medical packages in October or thereabout? How Kenyans complained that they were paying so much to be granted 2,000 shillings for dental services that were not immediately available. And how optical services package was capped at 1,000 shillings per family. Now, the ministry has heard the cry of Kenyans, and to correct it, a benefits package and tariffs advisory committee or advisory panel, BPTAP, has been established. Its work to, among other things, review and make recommendations on health benefits packages to ensure comprehensive care. But by when? CS Deborah Baraza said that the panel would ensure a comprehensive review of the benefits package expected within 2 years. 2 years. That would mean by February 2027, the great year of the election. Is there a sense of time at the Afya House? If a package has already been deemed insufficient within its first 4 months of implementation, how does that require 2 years to review? An employee earning 100,000 shillings monthly will have paid 66,000 shillings to SHA. If they earn 1 million shillings per month, they will have paid 660,000 shillings to SHA. For their optical services, they will have had 2,000 shillings available for their spouse and all children in their household for the 2 years. Does this make sense for a listening government? And that is my sense tonight.